Hi, I'm Colin Hung with Healthcare IT Today, where we explore the latest stories and interesting trends in health IT. On this episode, we're going to explore the use of AI technologies for no-shows and how AI could improve the no-show rates. Going on this journey with me today is Allison Connolly, Chief Medical Information Officer at Urban Health Plan. Allison, welcome to the program.
Thank you.
This is great. I'm excited that you're here. I just saw your presentation here at the eClinicalWorks conference. Amazing results, which we'll dive into in a moment.
Okay.
But maybe for our audience, Allison, could you tell us a little bit more about Urban Health Plan?
Sure. Urban Health Plan is a large federally qualified health center, actually a network of health centers in New York. We have offices, 12 clinics in Queens, Corona Queens, Harlem, and the Bronx. We also have 12 school-based health centers and a behavioral health clinic.
So Allison, can you share with our audience maybe a little bit about your patient demographics that you see?
Sure. So in 2022, we saw about 86,000 patients through approximately 400,000 visits. We have, and I should have mentioned, primary care along with about 18 subspecialties. We also do diagnostic imaging services such as mammogram, ultrasound, X-ray, DEXA, fundus photography to check for diabetic retinopathy. That's our primary services that we offer.
And you presented again some very interesting statistics. Can you talk to me a little bit about your no-show rate?
Sure. So historically, our no-show rate has been quite high, and we've always had or employed different strategies to try to address it. No-shows really create lots of operational problems at an organization. It could, most importantly, I think, reduce access, patient access. So if the schedule is full and it's filled with people that probably aren't going to come, you're using a slot for somebody that really needs to be seen. I think one of the other problems that it creates is overbooking. So as an effort to try to combat the high no-show rate, we typically overbook. The problem is when those patients come, it could cause several problems. It could lead to increased wait times for the patient, which could result in decreased patient satisfaction, increased stress for the providers and staff, and contribute to staff burnout. We also, another problem from an organization standpoint is that it could also really waste resources. So we're spending a lot of time doing pre-visit planning or chart prepping, and if those patients don't come, that time could have been spent doing something else.
So there's quite a lot of follow-on operational issues and challenges that are posed when there is a high number of no-shows.
Correct.
So how have you mitigated some of these no-shows in the past?
So something we've always done is appointment reminders per patient preference. So text messages, automated phone calls. We have found that with the automated calls, frequently about 10 to 15% of the patients hang up before even hearing the message, so they never even get that message. I do like texting more, where they have the ability to either confirm the appointment, cancel it, or reschedule it, have it rescheduled. So that's helped. We also, actually, we're in the process of looking for no-show software. So this came at a very opportune time as we were exploring different ways to address this issue.
Yeah, that's a great segue into my next question, which was around the eClinicalWorks AI technology that you spoke about, that you've deployed to help you identify patients or better identify patients with a higher % chance of no-shows. Can you tell me a little bit more about that technology and what your experience has been working with it?
So they share our highest risk no-show patients that we then have designated staff and centralized staff make phone calls, personalized calls to try to help engage these patients and make sure that they come in. So I think the fact that they provide such a focus, so we have about 3,000 appointments a day, it would be almost impossible to call all those patients. We do like for staff to do that, but when it gets busy, that's the first thing that's going to go. So having a focused approach, having a focused list of patients that we should call that could have a big impact has been incredibly helpful.
So is that what that AI engine is doing from eClinicalWorks, is sort of looking at the patients that have an appointment coming up and then identifying from that 3,000 the ones that it thinks that is most likely not to show?
Correct. That's exactly what it's doing. So it's looking at the patient population and it's categorizing them into 3 groups, either low show for not showing up, a moderate, or a high risk of not showing up. So we focused partially on the moderate high risk, but primarily on the high-risk no-show patients.
Right. So if you're more likely not to show up,
Correct.
then you would get these interventions of the text messages or the phone calls.
The live phone call, correct.
And by doing the prioritization, it gave your staff, I'm presuming, a little bit more focus to their work, so they weren't essentially wasting time on someone who's more likely to show up anyways.
Exactly. So it really helped focus our resources and made a huge difference from that standpoint.
So how has adding this AI changed some of your practices? I mean, I'm going to assume one of the things is that you're not overbooking as much as before, maybe? Or?
So we're trying to, what we are doing is looking at templates on a real-time basis. So if we look at a provider's template and their show rate is 80%, we're going to make sure we adjust the template accordingly and not have as many same-day slots available for that. Because if there's an 80% chance that the patients are coming, we don't want to overwhelm the provider and overbook them. So we are really trying to real-time adjust templates to based on the show rate.
Gotcha. Any other workflow changes or operational changes that have come as a result of this early work with the AI?
Yeah, so one of the things that we've done is we really looked overall at trying to increase patient access post-pandemic.
Okay.
So we've done a lot of things like increasing our hours. We have virtual care, so telehealth available till 10 o'clock every night. We have it available 7 days a week. Like I said, we added same-day slots. We also made the focused personalized phone calls, and all of these things have really helped the practice.
So am I understanding this right, that you're actually offering these as options to people when you connect with them to say, hey, listen, you had an appointment, but maybe you want to come in for a televisit because maybe you can't come in? These are the things
So those are some of the things we're doing. In addition to that, I think at the end of the session or during the day, the provider for the patients that didn't come are then going back and calling those patients and say, hey, I saw you had an appointment with me today, you weren't able to make it. Should we convert this visit to a telehealth visit? Can you do a telehealth visit now? And that's made a huge difference, and I think really helped improve patient satisfaction.
What advice would you give to somebody, a peer organization that might be having the same no-show challenges that you did, and who might be looking at a technology like what eClinicalWorks now offers? What would you say to them?
I think what's really key is having it integrated into the system. So that, to me, that's paramount. We did use in the past another algorithm that was very effective at identifying no-show patients. However, it wasn't integrated into the system. So being able to sustain something like that was really difficult. So having this integrated into eClinicalWorks is fantastic.
Hey, Allison, thank you so much for being on our program today. You shared a lot of wonderful information. But before you go, where can people go to find more information about Urban Health Plan? Sure,
they could go to urbanhealthplan.org and check us out online.
Allison, thank you again for being on our show today.
It was a pleasure. Thank you so much.
This has been Colin Hung with Healthcare IT Today. And if you enjoyed this interview as much as I did, we'd love for you to go and check out other great content on healthcareittoday.com. I'm Colin Hung. We'll catch you on the next video.